And breaking tonight, Fox News has just confirmed that while the president was promising you could keep your health care plan, the White House has known for almost 3 years, if not more, that that promise would not hold for millions of Americans. And we have evidence. Good evening, everyone. I'm Megyn Kelly. Americans heard this president say it over and over. If you like your doctor, if you like your plan, you can keep them under Obamacare. But many had doubts. One major concern, that those buying insurance on the individual market, people who don't have employer coverage, would see their plans canceled. Why? Because those plans tend to be cheap with less benefits. And Obamacare requires insurers to beef up their coverage. That costs money. The fear was that insurers that are forced to offer more benefits would also raise rates or maybe dump the policies altogether. And that's exactly what is happening. Contrary to the president's explicit promises. Listen.
Actually, any insurance that you currently have would be grandfathered in so you could keep. And so you could decide not to get in the exchange the better plan. I could keep my Acme insurance, just a high deductible catastrophic plan. I would not be required to get the better one.
But that's not what's happening at all. Exactly what he said would not happen is happening. You are required to get rid of your Acme plan. And you are required to buy one on the exchange, and it is costing Americans more. So far, nearly 1 million policies have been canceled. Over 10 million more could end very soon. We're talking maybe 14 million. And with the American people now demanding answers, you can keep your plan, period, today turned into maybe, for most, for the majority. Well, some can, et cetera, et cetera, et cetera. Here is former White House senior advisor David Axelrod earlier, and then some follow-up from our own Ed Henry.
Most people are going to keep their own plan, Senator, and you know that. The majority of people in this country, the vast majority of people in this country, are keeping their plan.
This morning, David Axelrod was pressed on that point and said the majority, the vast majority, will get to keep their plans. He no longer works at the White House. From that podium, will you admit that when the president said, if you have a plan, you'll get to keep it, that was not true?
Well, let's be clear. What the president said and what everybody said all along is that there are going to be changes brought about by the Affordable Care Act that create minimum standards of coverage.
Right. And then he also said that if you like your plan, you could keep it, period. And tonight we have dug up an IRS form from 2010 that shows that this administration knew that over 10 million Americans would not keep their plan, could not keep their doctor, and yet the president went out as recently as 2012 and said, if you like your plan, you could keep it. Meantime, there is a regulation, an IRS regulation, that was pushed by HHS, Human Services, that estimated that tens of millions were going to get dumped. Mark Thiessen is a fellow at the American Enterprise Institute and a former speechwriter for President George W. Bush. And I mean, this is it. It is one thing to say, we think you're going to, he said they were going to get to keep their plans, period. And now this regulation shows that that months after Obamacare was passed, July, it passed in March, July, or before, I should say, before they knew. They were estimating internally in the administration 10 million people are going to lose their insurance.
You've got the smoking gun right there in your hand. Look, they knew. When President Obama looked the American people in the eye and said, if you like your health insurance, you can keep your current plan, period, no matter what, that was a bald-faced lie. And he intended, and in fact, I think that they intended for these people to lose their health insurance. And the reason for that is, I mean, and as you pointed out, it's going to be up to 14 million people. Why would they want those people to lose their health insurance? Because they need those people to move into the exchanges to subsidize the poor people. See, the individual mandate is the most lucrative part. I mean, the individual market is the most lucrative part of the segment of the health insurance industry because those people don't use a lot of services and they're generally healthy. And so those are the people that they need to move into the exchanges in order to subsidize Obamacare. So while President Obama was going out there saying, you won't lose your health insurance, period, all along, they were planning for those people to lose their health insurance, 14 million of them, and move into the exchanges.
So the president, as we watch this healthcare.gov website falling apart, he doesn't have to worry. Because even though the young people aren't signing up right now, because the website is a mess, he knows that they're being canceled, that millions of Americans are being canceled and will have no choice but to sit on that website for hours and days on end eventually, because he knows, as we all know now, that millions of Americans are going to get canceled.
But there's the rub. They didn't anticipate the failure of the website. And so what the problem is now if you're one of these 14 million or so people who are losing their current health insurance, you're stuck with two options. One is to pay these exorbitant new premiums that you can't afford because they're raising your insurance rates between 99 and 400%. Or go into the exchanges, except because the website doesn't work, you can't get into the exchanges. And so what's going to happen is, what the unanticipated consequence of this is they're pushing all these millions of people out of their health care that they liked into Obamacare, except that people can't get into Obamacare. So on January 1, you're going to have millions, potentially millions of people who once had health care and no longer had it because of Obamacare.
In that soundbite we played, you had Senator John Kyle specifically asking the president, what about the individual insurance market?
Yeah.
What about people who have their plans there? You're raising the requirements. That's going to cost more. People are going to get canceled. And there you heard the president specifically speak to this issue, saying it's not true. You can keep your Acme plan if you like your Acme plan. That is not true. Mark, thank you.
Thank you, Megan.
We have much more on this, including this. In a Kelly